Since the COVID-19 pandemic began, researchers have found that people affected by diabetes are not more likely to become infected with COVID than people without diabetes. But if they do get COVID-19, adults living with both type 1 or type 2 diabetes are more likely to have serious symptoms and complications like pneumonia, and they are more likely to go to the hospital. They are also more likely to be sicker and die when they are in hospital compared to those without diabetes. People who already have diabetes-related health problems or are older are more likely to have worse outcomes if they get COVID, whichever type of diabetes they have. There is new research being published so fast, we're learning more every day, and what we know today could change. Children with diabetes, most often type 1 diabetes, are not at increased risk of getting COVID-19. And if they do get the virus, their symptoms seem to be like children without diabetes.
If you live with diabetes, what are some of the things that you can do to reduce your risk of severe COVID-19 infection? I guess first and foremost, it would be doing your best not to get COVID-19 infection in the first place. And that is, of course, following all of the advice that public health has been giving us in terms of physical distancing, washing our hands, wearing face masks, and avoiding touching our face and touching our noses. However, if you were to develop COVID-19 infection, one of the things that have been shown to be associated with more severe infection is in fact the blood sugar control. It appears that those who had better blood sugar control prior to the COVID-19 infection seem to do better compared to those whose A1Cs may have been higher going into the infection. And then during the infection itself, it also appears that better glucose control during that time is associated with better outcomes. Now, this is of course not proof that glucose control can be protective, but it certainly is suggestive of that fact. So I think the most important thing that one can do to protect themselves is avoid getting the infection in the first place, and then try to be in the best possible health going into an infection if that were to occur to you. And that would mean controlling blood sugars, controlling blood pressure, and controlling any other risk factors that you may have.
There have been reports in the media that COVID-19 can cause diabetes. To date, we have not heard of such cases in Canada. But knowledge of COVID is still evolving, and the strong research needed to fully understand whether this is happening will take time to complete. However, there are a few things we do know that might help us understand what is being reported. If someone who has COVID-19 is also diagnosed with diabetes for the first time, it might be that they had type 2 diabetes before COVID and were just not aware of it. In Canada, as many as 1.5 million people may have type 2 diabetes and not know it. That's because not everyone has equal access to healthcare, and not everyone is aware of the warning signs of diabetes. If you're wondering if you might be at risk of type 2 diabetes, you can take a quick online test called CanRisk. There's a link to it on the Diabetes Canada website. And speak with your doctor, nurse practitioner, or pharmacist. Some people who develop high blood sugar levels after being infected with COVID-19 may only have these levels while their body fights the virus. Once they have fully recovered from COVID-19, their blood sugar levels may return to pre-illness levels. Cases like this were observed during SARS, the first coronavirus outbreak in 2002 to 2004. And those patients' blood sugar levels returned to normal when they got better. While some research shows that viruses may play a role in developing type 1 diabetes, it usually takes months or years after having a virus. At this early stage, the research is showing an association between getting COVID-19 and them being diagnosed with diabetes. This doesn't necessarily mean that COVID causes diabetes, and more long-term research is needed to figure it out. To summarize, We need more research to understand if COVID-19 causes diabetes. Or are some people just finding out if they have pre-existing diabetes when they get COVID? An international group of leading diabetes researchers are working on finding the answer to this and other questions. Diabetes Canada will continue to monitor the research and provide updates and interpretations of this complex, ever-evolving situation.
If you live with diabetes, should you be vaccinated for COVID-19? The answer is yes. There are data in people living with both type 1 as well as type 2 diabetes within the COVID-19 vaccine trials. So therefore, yes, it is appropriate for you living with diabetes to get the COVID-19 vaccine. Now, in terms of prioritization, one usually turns to the National Advisory Committee on Immunization, also known as NACI for short, and they recently put out recommendations for COVID-19 prioritization. And those living with medical conditions that can cause more severe COVID-19 are included, and they are included at this present time in stage 3 in terms of the level of prioritization. So therefore, to recap, it is safe and appropriate for someone living with diabetes, be it type 1 or type 2 diabetes, to get the COVID-19 vaccine when it is in fact your turn to do so. And from a prioritization perspective, it has been discussed by NACI in their latest recommendations.